Today for Jacqueline, we're going to treat her pigmentation. So hyperpigmentation or excessive pigmentation is a common sign of sun damage that a lot of women accumulate as they get older, as the skin is exposed to more and more sun throughout the years. And sun damage is often something that accumulates from years gone by. So typically the sun damage that we see coming out now is often related to sun exposure that we've had way in the past. So even when women have given up using sunbeds, for example, they still often get signs of sun damage that become more prominent as they get older. And the main thing that concerns Jacqueline is the patches of pigmentation on her cheekbones here and here. If we just have a little bit of a closer look at the overall quality of her skin, though, you can see there is also some hyperpigmentation on both sides of the forehead up here. And there is also some vascular changes going on here. So this just looks a little bit red. We've got a few little red broken blood vessels around the corners of the nose here. So we will treat all of those as well. And the way that we're going to do that is by using a technology called intense pulse light, or IPL. So IPL has been around for about 20 years now, and it really is a staple of our practice. We use it all the time, and I would recommend it to pretty much all of our patients, purely because whilst the other treatments that we do in the clinic help to change the anatomy of the face and improve the structural changes to the face, IPL is really effective for treating the condition of the skin and improving the overall colour and clarity of the skin. So it's a really good treatment for just improving the overall quality of the skin. And the nice thing about it is that there's virtually no downtime with this. So with laser resurfacing, for example, then you need to be hiding away for a few days, and it's really quite uncomfortable. With this, it takes about 5 minutes to do the full face, and then after that, Jacqueline will be able to get back to her normal activity straight away. The pigmentation will go a little bit darker for a few days, but nothing that's going to stop her getting on with her normal activities. And we'll probably do maybe 4 sessions a month apart just to achieve the optimal result for her. But what I would like to see at the end of the course of treatment is just some really nice clear skin that's clear from the pigmentation and the vascular changes. So I'm going to hand over to Deborah, who is one of our therapists who does all of our IPL here in the clinic. And Deborah will take Jacqueline through the treatment. So the sort of pigmentation that IPL is most effective for are the small patches. Now you can have lots and lots and lots of small patches. And as long as the patch is smaller than about 1 centimetre in total, then IPL is likely to be effective. So in this case here, we've got lots and lots and lots of really small freckles, which are less than 1 centimetre each. So we're expecting to see a really good improvement here. When the pigmentation is much more confluent over the cheekbone, i.e. a single patch is greater than 1 centimetre, then IPL is usually less effective at treating these bigger lesions, especially melasma, which is often associated with hormones and pregnancy. If you suffer from that type of pigmentation, then that is usually better treated with topical creams, which can help to reduce pigmentation within the skin. IPL tends not to get rid of those bigger patches, and laser often does get rid of them, but can sometimes cause it to come back worse afterwards. So it's important that when we're treating IPL, we're treating pigmentation with IPL, that we are treating the right type of pigmentation to make sure that we're going to get a result that improves things for you, and definitely not a result that makes things worse. So it is quite uncomfortable having this done, but it's a short, sharp pain that's over with as quickly as the pulse of light. So as long as that little pulse lasts, that's as long as the discomfort lasts. Immediately afterwards, the pigmentation does look darker, and it can get progressively darker for 4 or 5 days before it lightens. The amount of redness that you get from this is usually very minor. This is the sort of treatment that we would expect most patients to be able to go back to normal activities immediately afterwards, without any obvious signs that they've had something done. Usually a course of treatment between 4 and 6 treatments is required, just depending on the extent of the pigmentation and the amount of improvement that the individual is hoping to achieve. Some people are happy with improvement. Some people want to keep going with the treatments until they can get as much clearance as possible. But that's the nice thing about the treatment. You can review the results as they're going along, and you can decide at which point you've reached where you're comfortable with the outcome, or whether or not you want to keep going to try and achieve further improvements. Typically, after you've completed a course of this, most patients will come back for a maintenance session, maybe every 6 months or a year. So a maintenance session is just doing one more treatment rather than another full course. And so long as you do that relatively frequently, maybe every 6 to 12 months, you should always be able to maintain your skin in better condition than where we started.